Medicos. Today we are going to study thrombus. Now, first of all, we have to see what is the word thrombus. Thrombus is basically a blood clot. We know that the final step of hemostasis results in formation of a blood clot, and that blood clot is ultimately dissolved. If it is not dissolved and it remains there as such, it will be called as thrombus. And now the process of formation of thrombus is called thrombosis. What are the factors involved in formation of thrombus? So there are basically three factors which are involved in thrombosis. First one is endothelial injury, second one is alteration in blood flow, and third one is hypercoagulability. Now we are going to study first factor in detail. So first factor is endothelial injury. Endothelial injury, we know this is the stimulus for the clot formation. Whenever our endothelium is injured, our subendothelial von Willebrand factor will become exposed, and the platelet will come and will bind to that von Willebrand factor through glycoprotein 1b and will lead to the formation of primary hemostatic plug, and then the clotting factors will come and they will form a fibrin, and that fibrin will accumulate there and result in formation of secondary platelet plug. So this is how damaged endothelium causes thrombus formation. Damaged endothelium exposes von Willebrand factor, and that the story I have told you, that will lead to the thrombus formation. So one thing can be endothelial injury. Second thing can be endothelial activation. Now what is called this endothelial activation and what are the reasons for this activation? So endothelial activation is basically a complex of these two changes. There are some changes in our endothelium. The first change is called procoagulant changes, and second one is antifibrinolytic effects. What are procoagulant changes? The procoagulant changes means there is down regulation of thrombomodulin will bind to the thrombin, and this thrombin will convert the protein C into its activated form, and then this activated protein C will help degrade our two factors, that is factor 5 and 8. So this is how thrombomodulin prevent thrombus formation. Whenever there is down regulation of thrombomodulin due to some reasons, these changes are called as procoagulant changes, and this will lead to the endothelial activation. Second thing is protein C down regulation. Thrombomodulin was activating basically the protein C, and protein C was inactivating our two factors 5 and 8. So in procoagulant changes, there is down regulation of thrombomodulin as well as protein C, and as there well as tissue factor protein inhibitor. So procoagulant changes are the complex of these changes. There is down regulation of this thrombomodulin, protein C, and tissue factor protein inhibitor. Its name indicates that it will inhibit tissue factor release from the endothelium, so preventing thrombus formation. But whenever these procoagulant changes are in our endothelium, this will lead to the endothelial activation, and that will lead to the thrombus formation. The second thing was antifibrinolytic effects. What are the antifibrinolytic effects? In antifibrinolytic effects, our activated endothelial cells downregulate tissue plasminogen activator that is also present on our endothelium. So the third thing that was present on tissue plasminogen activator, it was converting the plasminogen into its active form plasmin, and plasmin was fibrinolysing. So whenever there is down regulation of tissue plasminogen activator, these effects are called antifibrinolytic effects, and this is basically the endothelial activation. So these two things are leading towards the thrombus formation. Now what are the factors involved in the activation of endothelium? So here the endothelium is activated by infectious agents. If infectious agents are continuously causing injury at the endothelium at specific site, so one thing is infectious agent. Second thing is inflammatory agents, cytokines. Cytokines will cause these procoagulant changes, and this is how they will lead towards the thrombus formation. Inflammatory products. Third thing is cigarette smoke, cigarette toxin. Fourth thing is hypercholesteremia. And fifth thing is homocystinemia. Now this homocysteine is present in our blood more than in quantity, then this will lead to the increase in release of tissue factor. And the second thing was alteration in blood flow. First thing was endothelial injury, and the second factor is alteration in blood flow. Normally our blood flow is laminar. What is meant by this word? The blood flows in our vessels in such a manner that blood cells are present in our center and the plasma is surrounding these cells, means that these cells are separated from the endothelium through a layer of plasma. So normal blood flow is laminar. But whenever there is stasis, like consider here is slowing down of this blood. Consider this is the vessel is dilated and here is slowing down of this blood. This laminar blood flow will be affected and this will lead to the contact of platelets with the endothelium. Or the second reason can be this turbulence. If I place something here, then again there will be the contact of platelets to the endothelium. So these factors, whenever there is stasis or turbulence, there can be activation of thrombus formation. How it led to the thrombus formation? Whenever there is stasis or turbulence, there will be first thing that will be the contact of platelets to the endothelium, and these platelets when comes in contact with the endothelium, that will favor thrombus formation. The second thing is endothelial activation. Now how this endothelial activation occurs whenever our blood is facing some turbulence or whenever our blood flow is slowing down. So this is here basically is flow induced expression of adhesion molecule. Whenever our blood flow is slow, there is flow induced expression of adhesion molecule, and also there is pro-inflammatory changes, inflammatory factors release. So this is how endothelial activation occurs whenever there is some turbulence or there is slowing down of blood. Third thing is no dilution, means consider here was the formation of platelet plug, here was the endothelial was injured and here was the platelets plug formation. Whenever normal blood flow is present, it will cause the dilution, like it will wash out the activated clotting factors around this platelet plug and will also bring clotting factors inhibitors. So thrombus formation will be or clot formation will be restricted. But whenever there is there is stasis of blood, there is turbulence, there will be no washing out of clotting factors. Clotting factors will remain there in their activated form and they will continue clot formation, and no incoming of clotting factors inhibitors. So this is how stasis and turbulence will lead to thrombus formation. Whenever there is stasis or turbulence, there is contact of platelets to the endothelium. And second thing is endothelial activation. Third one is there is no dilution. So these three factors will lead to the thrombus formation. Now we will study what are the reasons for this stasis or turbulence. So let's see what are the reasons for this turbulence. First thing can be if there is aneurysm. What is aneurysm? Aneurysm is dilation of arteries at specific point. So consider here a vessel is dilated, blood was in laminar flow, but whenever this region will come here, the blood will not be no more be laminar, and this will lead to the formation of thrombus through the three factors that I have discussed, that there will be the contact of platelets with this endothelium, there will be the endothelial activation, and there will be the no washing out of the clotting factors. So this is how aneurysm will lead to the thrombus formation. Second thing, if there is consider there is some turbulence, consider again this is a vessel. Now consider there was a atherosclerotic plaque in our vessel wall. This atherosclerotic plaque will ulcer at some time and will lead to the endothelial injury, and the platelet plug will be start forming here. So this ulcerated atherosclerotic plaque will provide turbulence to our blood flow, and that's how there will be the clot formation. The third thing, there can be MI. We know what is myocardial infarction. In myocardial infarction, there is compromise in blood supply to some portion of our heart that will lead to the infarction of that portion, and that portion will be necrosed, and that will be no more contracting. So after myocardial infarction, there will be some portion of the heart that will be non-contracting, and the non-contracting portion will face the stasis of blood, and this will lead to the clot formation. Three things we have studied: ulcerated atherosclerotic plaque, second was the aneurysm, and third is the after myocardial infarction there is some portion of non-contractile myocardium which will face the problem of stasis of blood, and that will lead to the thrombus formation in heart. Fourth thing is mitral valve stenosis. If there is mitral valve stenosis, means that the valve is now not open as it should be. So if there is mitral valve stenosis, in the left atrium there will be the stasis of blood, and again this stasis will lead to the thrombus formation. Now fifth thing is hyperviscosity. Whenever there are large number of RBCs in our blood, like you can consider a thing that is polycythemia. Polycythemia is basically a problem in which there are more than usual number of RBCs, and it can be of two types. It can be physiological as well as pathological. So in polycythemia there is increased number of RBCs, and whenever there is increased number of RBCs, the blood will be thick and it will face some difficulty in flowing. So there will be again stasis, and this stasis will promote thrombus formation. Sixth thing can be anemia. In sickle cell, basically sickle cell anemia. Sickle cell anemia, we know our RBCs our RBCs are no more spherical, they attain a shape of sickle, and they will block the vessel lumen, and they will provide the turbulence which will lead to the thrombus formation.